Overcoming clinical inertia in patients with type 2 diabetes is paramount to improving outcomes. In this second episode of Increasing Options to Improve Outcomes, examining the role of once-weekly basal insulin formulations, Dr. Athena Philis-Tsimikas examines practical, patient-centered strategies to overcome barriers to insulin initiation and intensification. Access the full series and complete the post-test at peerview.com/KNZ860.
So what do we know about barriers to treatment intensification with insulin therapy? We know that some of the main barriers include things like both weight gain and hypoglycemia. Both of these can play a role in whether someone will use their insulin as prescribed. In addition to that, there's significant complexity to taking insulin, especially if you have to take basal-bolus doses. This is where you might need to take 2, 3, or even 4 injections a day. This was a large database study that looked at over 250,000 patients, 335,000 patients in the United States from this database. And it looked at people that were started on either basal insulin or basal-bolus insulin combination and followed over time. And if you look at the bottom, what you see is those started on basal insulin alone, a mere 41% were still adherent at the end of that year. And basal-bolus cohorts that might have to take multiple doses of insulin in a day had only about a fifth, 19 to 20% that were still adherent at that time period. So really fairly abysmal adherence to medications when you have to take them on a regular basis or multiple times in the day. In this study, it looked at patients that were seen in their physician offices and how often were these patients taught to use basal insulin properly, as well as all the potential side effects that they needed to be on the lookout for. And if you look really just at the bottom line of this, how many patients did not have any education at all? It was a significant 21% never received education on how to use their insulin. Some may have had some in-office training, 62%. Some might have been handed some educational materials, around 20%, or a rare few were lucky enough to get an NP or a certified diabetes educator that could support them. What are some patient-centered strategies that can improve both treatment acceptance and adherence? We could start with some education that explains that poor treatment adherence can lead to worsening glycemic control as well as higher costs. But additionally, if we could offer patients less dosing frequency. Currently, it's once a day for basal insulin. If you have to use bolus, it might require multiple doses within the day. You need to think about also testing your blood sugar more frequently. Shared decision-making is always important, and having a discussion with your patient to find what works best and what that patient might be willing to tolerate as well. A number of advances have been made in the actual devices and the delivery devices of insulins, and all the basal insulins at this point are available as pre-filled pens. Some are available in more concentrated amounts as well, so that the actual volume of the injection can be a little bit less. This makes it much easier for patients, especially if all they need to do is dial it up and then press with a very easy click pen to deliver the insulin dose. Some open discussion with the patient could be valuable. Some of the points that were made in a recent study by Laurie Berard show that letting the patient know that although you might want them to achieve a specific target for hemoglobin A1C or for blood sugar measurements, that it will take some time to reach that goal and not to expect to achieve this within 1 or 2 week time frame. Having them understand what the potential final dose might be can also be valuable, and that can be calculated. We know that most basal insulins would require about 0.5 units per kilogram, so you can do a quick calculation with this. You would know about what their final dose could be and have a discussion with the patient around this as well. So to summarize, for this specific case, a 74-year-old that has a long history of type 2 diabetes, she's not meeting her glycemic targets, and she's having problems with injections due to her rheumatoid arthritis. What could be the best option for someone like this? And although several of the options given here could be considered, a home health nurse certainly, but it would still be someone that may need to come to the home every day, which can get expensive. You could try and find a time in the day that would work best for her when the rheumatoid arthritis is not quite as significant or painful. That's a choice, and if that's the only approach, that might be better than having to do it later when it might be more painful, but still probably not optimal. And could you counsel her that she really needs to work through the pain to prevent the development of diabetes-related complications? Would be a fairly harsh approach and probably not one that would sit very well and resonate with a patient. But if you could offer her an injection that could be used just once a week and still help her manage and achieve the goals that she has with the basal insulin, that certainly would be the best option possible.
Thank you for listening. Download materials and complete the post test for instant credit at peerview.com/KNZ860. This activity is supported by an educational grant from Novo Nordisk Incorporated.